Welcome to Doing Death Differently, a community honoring the culture of death. I'm Bethann, your guide in exploring end-of-life care and the art of dying well. As a death midwife, hospice nurse, and end-of-life educational consultant, I facilitate meaningful conversations to transform how we approach death. This session is titled Understanding Hospice. It is the first in a series of hospice videos. In our time together, we'll explore what is hospice, who is eligible, general information, services provided. I am so glad you are here. What is hospice? Hospice is a program that provides compassionate care and support for people nearing the end of life, where the focus is on comfort and quality of life. A specially trained team of healthcare professionals provide care for the whole person: physical, mental, emotional, and spiritual needs. Hospice helps people who are terminally ill live and die comfortably. The focus is on comfort care instead of care to cure your illness. Hospice treats the person and the symptoms of the disease, rather than treating the disease itself. Both the patient and loved ones receive care and support. The hospice team is available 24/7 to give you and your family support when you need it. Hospice philosophy accepts death as the final stage of life. It affirms life and does not try to hasten or postpone death. Hospice is a Medicare benefit available to individuals who have a life-limiting diagnosis and have chosen to discontinue curative treatment. As a Medicare benefit, it is available for everyone over 65, as well as those under 65 if they meet certain criteria. Many other insurance companies mimic the Medicare benefits. Medicare fully covers all the hospice services that relate to the terminal illness. Patients incur no costs for these services, and there's no deductible. So who is eligible for hospice? Anyone who has a life-limiting illness who is no longer seeking curative treatment. In determining eligibility, a physician has to certify a life expectancy of 6 months or less if the illness runs its normal course. This certification of terminal illness, the document I am referring to, is what Medicare requires. In simpler words, a physician signs a paper that says, "I think to the best of my knowledge that this person will die in the next 6 months if the illness runs its normal course." So what happens towards the end of that 6-month period? The hospice team completes a recertification process to provide data that shows quantifiable decline. If there is decline, then eligibility and benefits continue without interruption. If there is no measurable decline, hospice is required to discontinue services. Sometimes we describe this as graduating. The formal verbiage is discharged for extended prognosis. In today's world, there are various medical conditions where one's decline can be quite slow and steady. Some of these include dementia or Alzheimer's, Parkinson's disease, ALS, which is Lou Gehrig's disease, and COPD, a respiratory condition. These illnesses and many others are still eligible for hospice. Then support is available throughout the course of the illness and later at the end of life. While on service, if your health improves or your illness goes into remission, you may no longer need hospice care. However, in the future, you can resume services as long as you are eligible. The important thing to remember is that hospice benefits remain available and never run out. There is no expiration date. If you have questions about eligibility, check with your local hospice or contact me for more information. Hospice care is a powerful resource, often misunderstood. Many believe it's only for the final days of life, but this misconception robs people of invaluable support. As a hospice nurse, I've seen families discover its benefits too late, and they ask me over and over again, why didn't I know about this sooner? Why didn't somebody tell me about these services? This knowledge gap means missed opportunities for comfort, dignity, and quality time. The truth is, hospice is not just about dying. It's about living fully in your remaining time. It offers expert care, pain management, and emotional support for both patients and families. By understanding hospice as a resource for living, not just for the end of life, we can transform experiences for ourselves and loved ones. Hospice is about making every moment count, managing symptoms effectively, and providing peace of mind. Hospice care is typically provided at home, which enables patients to be home and families to stay together. These services are also available in assisted living facilities, nursing homes, and dedicated hospice houses. At its core, the hospice philosophy emphasizes comfort and holistically addresses the needs of both patients and their loved ones through a comprehensive, multidisciplinary approach. The following is a list of some of the services hospice provides. I will read them in case this information is new to you. Nursing care and case management, medical social workers, spiritual care counselors and chaplains, doctors and nurse practitioners, medical equipment, personal care supplies, medications for your diagnoses and for comfort, hospice aids, grief and loss support, bereavement counseling during and after, volunteers, respite care, and in some situations, physical, occupational, or speech therapy. In summary, hospice is here to support life, offer comfort, and preserve dignity. Understanding its true nature could make all the difference, allowing more people to benefit from this incredible support when they need it the most. My goal is to reach as many people as possible with accurate knowledge, empowering you to advocate for yourself and your loved ones. I believe it is our birthright to live and die well.